Grassroots health centers play a crucial role in keeping the health of a rural community, providing accessible healthcare services as well as emergency response and treatment. These health centers ensure that the medical needs of the local populace are well taken care of. The Barangay Irawan Birthing Facility in Puerto Princesa City, Palawan has served more than 1,000 women since it opened its doors back in 2015. Catering to the nearby barangays as well as indigents from far-flung communities, this facility has been a lifeline for the underserved thanks to its accessibility.
Napakalaga po ng birthing facility lalo na po dito sa amin sa Barangay Irawan. Kami po yung parang nasa sentro, liban po sa birthing home. Yung health center din po namin na ito, pag minsan may mga aksidente sa kalsada, dito po nadadala para po bigyan po siya ng pangunahing lunas.
May mga kababayan tayong katutubo na kuminsan siyempre takot silang mga anak sa ospital. Siguro hanggang ospital po abutin din siguro ng mga hanggang 1.5 oras po. Yung iba naglalakad. Ginagawa nila parang bubuhatin lang po yung pasyente tapos ibababa po doon sa may kalsada po na pwedeng abutin ng sasakyan.
Building a birthing facility in his community has always been the top priority of Barangay Captain Noel Resuma, inspired by his late wife's unwavering dedication as a midwife.
Kahit anong oras, anytime, mapaaraw, mapagabi, talagang kailangan niyang puntahan. Pag nagbabakuna sila, nagsisikap ng mga buntis, minsan sa mga purok-purok lang, tiyatabingan lang nila ng kumot, minsan sa ilalim ng punong kahoy, nagbabakuna. Nawala na yung asawa ko kasi talagang kahit wala na, pinursigi ko pa rin dahil ng mga pangarap namin. Ang gusto lang namin, masiguro yung kaligtasan ng mga anak. Ang gusto lang namin, yun, makapagbigay ng serbisyo, makapagbigay ng tulong.
Despite having very few resources, the birthing home in Barangay Irawan continued to provide essential healthcare services to its constituents. But in 2017, the facility faced a major setback.
Nasimula ang construction niyan, ang daming tumulong niyan, yung mga agencies, yung delivery table namin, yung hospital bed, bigay lang yan eh. Pero yun nga, ang daming hinahanap ng Diyos. Gagawa ka na lang para may pondo naman para pag anytime may dumating, may magagamit. Kasi yung panganganak parang ano yan eh, parang 24/7 na tindahan.
Lahat po naman ng mga midwives po dito ay mga lisensyado naman po. Ang pinaka-importante po talaga i-lisensya para po ma-operate po siya. Para lahat po ng mga anak, mayroon po silang proteksyon.
As they needed to halt their birthing services due to the lack of necessary accreditation from the DOH, the pregnant residents of Barangay Irawan and nearby communities now have to travel to other parts of Puerto Princesa City for their healthcare needs, posing a risk to their vulnerable state.
Mahaba po ang pila. Karamihan po kasi ng mga OB-GYN sa bayan is hindi po sila tumatanggap ng schedule, walk-in lang po. So kailangan namin maghintay.
Sobrang hirap po kasi napakalayo po ng ospital dito sa amin, lalo na po dito sa Barangay Irawan. Kailangan po nila kumuha ng sasakyan para po mag-arkila pa papunta ng bayan. Then sobrang hirap po kasi lalo na yung mga wala po kakayahan na magbayad ng malaki, lalo na po yung mga wala kakayahan na manganak sa mga private na paanakan.
Left idle and unused for the past 6 years, the physical condition of the once bustling center has now become an image of decay and neglect. Its closure greatly affected the safety and well-being of pregnant women in the community.
Malaking pagkadismaya talaga, malungkot. At yun, bumalik na naman, meron na namang nanganganak sa bahay. May mga pangyayari pa nga na may nadisgrasya kasi hilot yung nagpanak. Pagdating sa ospital, di doon arrival na.
Nangyayari, nanganganak na lang sila sa bahay. Isa yun sa mga risgo na binabawal po talaga ni DOH.
The mission to revitalize the community facility may prove challenging, but Noel and the midwives of Barangay Irawan Birthing Home remain undeterred. Hopeful that one day, the center will rise once again to better serve its constituents.
Yung pangarap ko na maging licensed na birthing home na siya. Kagaya nga ng pangarap ko, katulad ng sinabi ng ating mayor, wala namang ginagastos, walang gagastusin yung ating mga mamamayan dyan.
Our uniformed personnel are often the picture of strength and health. They are one of our modern-day heroes who have sworn to protect the citizenry. Still, they are human. The Naval Station Apolinario Halandoon Medical Dispensary in Puerto Princesa City, Palawan is the main health center of our Navy personnel tasked to patrol the West Philippine Sea.
Yung medical dispensary, sila yung tumutugon dun sa mga pangangailangan na medical ng mga sundalo natin na nasa mga isla or nasa mga barko.
As Navy officers in the West Philippine Sea are stationed remotely, far from hospitals or the medical dispensary, they rely on first aid or teleconsult to tend to compromised personnel. Shipping medical supplies and transporting back sick soldiers to the dispensary are also a challenge.
Ang ginagamit lang po nila is either rubber boat or malilit po na bangka. So yung weather po kasi is pabugso-bugso talaga, pabago-bago. So pwede pong kalmado ngayon, pwedeng sa susunod na araw is maalon na po. Pag nasa isla sila, syempre sila lang po doon.
Though operational, the medical dispensary is already in dire need of an upgrade.
Kung makaroon po kami, ma-improve po yung dispensary, magiging mas maganda po yung capability namin na makapagbigay po kami ng magandang services sa military.
Despite the limitations of Barangay Irawan Birthing Home and the Naval Station, Apolinario Halandoon Medical Dispensary, their staff continue to show unwavering commitment in providing the healthcare needs of their communities.
The impact of accessible healthcare on vulnerable populations goes beyond medical terms. It instills a sense of dignity and worth in those who might otherwise feel marginalized. Furthermore, let us not forget the indispensable role of community healthcare workers who tirelessly serve at these centers. These dedicated individuals are the lifeblood of our grassroots healthcare system.
With the unmatched dedication of the health workers, how efficient would these health facilities be if they were empowered to attain modern standards?
Healthcare, as we all know, is an essential aspect of human well-being. Through its unwavering dedication and tireless efforts, SM Foundation has become a beacon of hope, uplifting the lives of countless individuals and fostering positive change.
Through their health programs, the Social Good Arm has committed to improving healthcare infrastructures across the country.
By the end of 2022, the SM Foundation has achieved an impressive milestone of establishing 184 health and wellness centers, serving over 5 million patients. These numbers stand as a testament to the organization's unwavering dedication to the well-being of our communities.
Partnering with the local government of Puerto Princesa City, Palawan, and the Philippine Navy, the social good arm has renovated both the Barangay Irawan birthing facility and Naval Station Apolinario Halandoon Medical Dispensary. The centers underwent 2 months of reconstruction and refurbishing. To give new life and renewed hope to the communities they serve. Both have been equipped with medical facilities that comply with the guidelines of the Department of Health. But more than going through progressive upgrade,
Every 4 hours.
We have incorporated innovative solutions such as rainwater catchment systems to ensure efficient water management within the facility. By employing energy-efficient LED lighting fixtures and inverter appliances, we optimize energy consumption and reduce our ecological footprint. We have taken significant steps to enhance indoor air quality in this health center by coating 80% of the facility with air cleaning paints.
complementing the turnover of the new facilities, the social good arm also conducted medical and dental missions for the constituents of Barangay Irawan and authorized civilians and dependents of the medical dispensary.
Very thankful kami sa SM Foundation Incorporated kasi very helpful yung ginawang renovation dito sa medical dispensary to boost the morale of our Navy personnel.
Ako talagang tuwang-tuwa ako at masayang-masaya kasi ang dami ko na rin napuntang mga birthing home. Malayong-malayo siya dito sa ating binigay ng SM Foundation na malaking tulong talaga sa mga kabarangay ko. At sana marami pang matulungan yung SM Foundation, lalo na pagdating sa kalusugan.
Serving as a beacon of hope in delivering the much-needed medical assistance to those who need it most.
Let this health center serve as a reminder that progress should be inclusive, leaving no one behind in our collective journey toward a brighter future.